When we were vacationing down south in Arizona, a bunch of buddies of mine were sitting around having an afternoon happy hour, and I say, hey guys, saw on the news they say that the rise in cancer case patients is very, very much, and there's a good chance that one of us might even have cancer, eh? About 2 months later, come back and ta-da-da, I'm diagnosed with cancer, eh? Like it was so, almost like somebody upstairs, hey, Jim, you shouldn't be joking about it, eh? They found a tumor in the rectum, and they found a second tumor in the liver. Oh, I tell you, that was terrible. I just said, well, firm up your lip and try and fight it, and I wanted to hang around for a little bit longer, basically for wife and kids and grandkids, eh? Like I wanted to enjoy more of my life, eh?
Cancer is usually treated by multiple disciplines. Mainly, they can be divided into three main categories. The first one is surgery, second, radiotherapy, third, drug treatment, which we also call systemic treatment, meaning treating the whole body. Many of the cancer treatments encompass a combination of one or more of these kind of treatments. Cancer treatment these days is not a prescription or a recommendation. It's more of a shared decision making. We take into consideration the patient's preferences in life, what they want, what are they comfortable with, and what is the main goal of treatment.
The first day going in, well, like I say, I was nervous naturally. From the time you come in, the receptionist, they want to see your little pink card and that, but they were all very, very good. You have your appointments, and I don't think I probably waited any longer than maybe 20 minutes, half an hour at the longest, eh? The nurse introduced herself. They explained to me that they were going to administer the two different medications, and two nurses work together to make sure that you get the proper meds, right?
Most chemotherapies are given by the vein, so it's intravenous. So we suggest frequently that people consider intravenous access. There's a couple of types of intravenous access that are offered. They're called PICC line, which is inserted from the arm.
What they do is they find the vein that they find the best. So they measure exactly from where they insert it. They use a needle and make a hole in your vein, and then they follow it, going all the way through down to where they want it to be. They explained it to me what they were going to do, and it didn't hurt. That's the biggest thing, eh? So I didn't mind. And the only thing was afterwards, then they gave me the instruction, you couldn't lift anything heavier and stuff.
The other type is what we call Port-A-Cath, which sits under the skin in the chest, which is basically for convenience purpose, so we don't need to insert a needle every time the patient comes. The intravenous access stays there during the period of chemotherapy, and it's taken out once the planned chemotherapy is completed. Chemotherapy acts on dividing cells in the body, and we all have cells in our body that are dividing. But cancer cells divide faster than other normal cells in the body. So chemotherapy attacks fast-growing cells in the body and then leads to the death of cancer cells. The side effects of chemotherapy is by far what causes a lot of fear in people who are anticipating chemotherapy. So you need to talk to your doctor about what to expect, what precautions to take, and what are the ways to mitigate any hardship that you may face.
You always hear the story, the cure is as bad as the disease. And that was the biggest thing that I was afraid of, was being super, super sick with it, like nauseous and vomiting and all that stuff. They gave me some anti-nausea medication ahead of time, And basically sitting back there, and I really didn't feel any sensations or anything. It was just, I think I did very well, really. And, and like I say, felt a bit like my throat, a little bit different, and walking out the tingling. But I said, well, if they're all going to be as good as this, it's a good thing. They do their very best to take away your fears. You're treated with dignity, kindness, and, showing you to comfortable place to relax, while they're treating you. And they don't treat you just as a number. You're treated as a person. 8 and 8, 16. I'm over the skunk line. I'd like to say that I will not have any more cancer coming, and possibly next year we can maybe go down south again for 2 or 3 or 4 months again,
Several sites within Winnipeg and across the province provide cancer treatments such as chemotherapy and follow-up appointments, allowing patients to be treated closer to their families and community supports. Ask your Cancer Care Manitoba healthcare team about sites closer to your home.